that we need to do is to figure out where the child is lacking in reading or why. So often when we just clarify the basic phonic sounds, it's not enough for a child to begin reading. The reason being that they are not visually familiar with the words. So in that case, your child might need to be exposed more to sight words. They may also have to have more exposure to the language of, I mean, the familiarity with read out language. That also has to be there. And the third thing would be that in their language use, they would have to increase their vocabulary. So the vocabulary can be increased by introducing word files and, having the child get introduced to 2 new words every day. But when we introduce them to 2 new words, we have to make sure that they know to make at least 3 different sentences from it. So, not just sharing the meaning, but getting to use it in a context is important. So only then the child will be able to retain that word for further use. Then we would need also that our child gets constantly encouraged to express themselves in language, repeatedly without much judgment and criticism. So, but with a gentle push towards using better expression. So I would say the direction of our reading interventions tends to be very diverse. It has to be based on the needs of the child. So when the child is ready with the phonics, the second part that comes in may be the visual synthesis of the words, or it may be the auditory synthesis of the words. So at that time, you might want to introduce some other types of intervention, like say, what shall we say? I think you might have heard of these interventions, perhaps, of using nonsense words which sound like real words and having them discriminate between them. Then also removing certain parts of the word, and then like phonemic deletion, those activities would help them to understand their reading better. And then using phonological activities also tends to improve reading when only phonics doesn't work. So I think there's a whole gamut of things, and I've just tried to tell you a few of them. So we need to figure out where the problem is and then coach the child in that area specifically with much more practice.
Absolutely. Listening comes natural, speaking comes natural to us, but reading is a conscious effort. So we have to make the child do that conscious effort over and over again. Thank you so much for that answer, Dr. Sudipta. We have a next question from Harsha Ashish. Harsh Yogini. My daughter is 5 years, 6 months. I tried talking positive to her, but still she doesn't listen. She do things deliberately, doesn't eat food by herself except unhealthy food items, and cries a lot, but is very stubborn. She will cry, 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 but will not listen to things. Always do opposite of what I ask her to do. Kindly advise.
So this is a very common experience, I think, between 2 to 5 year olds, that somehow whatever mother says is not going to be followed, and there's a lot of opposition. So I think what has happened with you is you've entered into a power struggle with the child, and that can be quite a costly affair for one so young. So the first thing you have to do as a mom is to give up that power struggle. That doesn't mean that she has won or your child has won. It's just that you have let her take the lead in understanding her needs better and then complying to social rules or the rules that you're trying to feed her. So it's something like, bending down to allow certain other things to grow and happen, like that. So you need to allow, whenever you enter in a situation where you want her to do something, you can bend down and look into her eyes directly, like kneel down on your knees, face her at the eye level, and then tell her gently what you want her to do. Don't tell her what you don't want her to do. Just tell her what you want her to do. And then, if she doesn't do it, you can hold her hand gently, take her to what she's supposed to do, and help her do it with you. Now, if these interventions come from a place of love, understanding, and gentle direction, then they are more likely to be met. But if they're coming from, okay, you're my kid and you better just do what I tell you, you know, then the likelihood of it being followed is less. So these are some subtle things which you might try, but there would be other things you will need to do, and you may have to come back to Bala ma'am and seek more advice later on after implementing these few.
Thank you so much, ma'am, for that answer. Yes, coming down to the child's eye level, connecting with her makes a lot of difference in communication. And this is not for a mother, it's also for every teacher, because this height makes a lot of difference. But when you come down to their eye level, the life changes for them. Thank you so much. So the next question is by Pooja Bali. As a teacher, what areas should we focus to understand child's problem? Now, she's a government school teacher from Kashmir, and she's doing amazing work with not only her school children, but all the neighborhood, because she knows that there's a lot of gap in their learning because lack of availability of education facility in remote areas, especially in such districts. So I think the question is coming from that feeling for the child, for as a teacher.
Yes. How wonderful to hear of your work. And really must congratulate you on that effort. And can you please repeat the question once again?
Yeah, sure. The question is, as a teacher, what areas should we focus to understand child's problem? I know it's a very generic question because if it is the problem is mentioned, then you can identify what areas to focus.
So basically what I think is that when we're thinking of education, we have to give it a very holistic meaning. So there is like, I'm sure at some point you would have as teachers reflected on it, and Bala ma'am also may have brought things like that to your attention. That very often we tend to confine our understanding of the process of education to the book related learning that they are supposed to do. So we think there should be 6 subjects and there should be this much of syllabus and all the syllabus has to be covered. But from my point of view, when I think of it as a psychologist, then I think that here is a group of children who are going to become future citizens of the world, and I want them to be groomed into good human beings, and they people who are capable of thinking for themselves, people who can take decisions in favor of not harming others, in favor of doing what's best by them and the world around them. So for me, I think it's very holistic. The whole idea of education has to be very holistic. So where would you focus your attention? I think that you need to build connections with your students. That's one very important area that I see for a teacher. And building those connections at a personal level helps you to reinstate the students' faith in humanity to some extent, and also it gives them future goals to aspire for. So if you understand the students, you spend that extra time getting to know them, getting to know about their lives and their feelings in a very minimal way. I don't mean as a gossip, like the way we sit and talk about, oh, XY, you know, XY did this, that. And then, you know, we say, hey, uske ghar mein ye ho raha tha. That kind of talk is not connection. It is a way of putting down somebody in your mind.
Yeah.
So we don't want that. We want a very meaningful connection, be it however fleeting it is, with every child in your classroom or in your school. So if we are able to establish that, then you would make a huge contribution to the world around you. Because here would be a child who's been in your school, in your presence, has begun to value human beings, has begun to value feelings, has begun to value their behaviors. So in a sense, it sounds like value education, but it's not value education. I'm talking about education with a value. And I'm also thinking of the other part that for me, I think life skills is an inherent part of everybody's growth. There should be an inherent learned curriculum in the schools, learned and practiced curriculum, rather than having a huge amount of lessons. Like, I often question after meeting LD children, I often question in my mind, like in my English textbook in 10th standard, I had 36 chapters. And I wonder that whether those 36 chapters were really important for me to appreciate literature.
Absolutely.
So I could have had 6 chapters and had a very beautiful understanding of literature. I could have appreciated those authors. I could have grown in my vocabulary through 6 pieces which I studied beautifully and deeply.
Yes. Yes.
Right. So as a teacher, I think that we need to maybe sometimes question the ground which we are walking on and the ground which has been handed over to us. So we cannot just accept it in face value. We might want to make our own transformations. And that's what I think coaching is all about, making transformations from your inner self and in the environments where you are. So just to come and summarize what I might want to say through this question or this answer is that the important thing to really focus on is to give a meaningful life experience to the child who's handed over to you. Treat them with love and respect, teach them life skills, and teach them what you need to teach them with the value. That's the summary of it.
Wonderfully. Very, very one. Though the question was very generic, but it's answered really nice. Thank you so much, Dr. Sudipta. Let's go to the next question. It is by Sati. I have a student in class 7. He has a rare disease called Prader-Willi. He is intelligent, but yeah, I might be pronouncing it wrong. He is intelligent, poor in maths. With continuous efforts, he managed to pass in the 3rd terminal exam. After spending 1 month with his grandmother, he forgot even multiplication tables. His handwriting is peculiar. He uses only straight lines. What's your question, Sati? I can't get more than this. Sati, if you can specify. Hello, Sati, are you there?
Yeah, yes,
Yeah. So could you please tell your question?
Yeah.
You described the case quite well.
Yeah. This boy came to me around 6 months ago. He was very poor in maths. As according to his parents, he was very poor in maths. He had attended so many teachers, and somehow or other he couldn't keep on. And he is such a person that he wants your full attention on him. That's what I understood from the days he started here in my class. He writes in such a way that I can't read all straight lines. All straight lines. He can't.
Can't make curves.
No curves.
Oh.
No.
Even
no
the curve
curves.
letters and curve numbers are straight.
Every small letter, capital letter, everything in straight lines.
Okay.
And his hands are very small. He has growth deficiency. So he says he can't hold the pencil properly. His parents say he can't hold it. He was in 6th last year. So, but I felt they have put in his mind, you can't do this, you can't do this, you can't hold this. So I was trying to implement my own ways of bringing him up. Hey, this is better if you write this. If you can write this, This will be better. Oh, now you write better. Like that, I
Great.
used to encourage. And he used to limit his letters in two-line book. Two line.
Sati, what's your question exactly?
Now he is not at all interested in learning. He
Okay.
wants to be with his grandmother throughout the vacation. I won't come, he says.
Okay.
Now he has to undergo an injection every day, 1,000 rupees injection for his growth. So his father will be leaving soon to Dubai to make money. So
Okay.
if father is also not there, he is afraid of his father. Father is also not there. Only mother has to manage him. Mother mm, has some textile business. Nobody is as far as I can understand. Nobody is looking after him properly. He has a sister who is very stubborn.
Okay.
So
So I understand your concern for the family, I mean, for the boy and the condition of the family. So, Dr. Sudipta, what does a teacher, especially of Sati's age, do? She's just joined our platform. She's very young, wants to learn and help many children. So, what does a teacher like her do in such a situation?
I think that in some case, I think what you're talking about is a Prader-Willi syndrome. It must be a genetic syndrome in which there is mental retardation or intellectual disability, along with certain physical characteristics which are limiting the, the sensory motor activities of the child. So, I think we have to choose our goals very carefully for such a child, and we have to help the parents understand the child well. A common thing with parents of children with Prader-Willi syndrome is they appear very close to normal, and the parents tend to have normal expectations from the child,
Oh,
whereas there are serious brain limitations in the child. So, and they are assigned to laziness. So, typically these children will be appearing also a little bit lazy. Their body language is also very sluggish on the whole. So we have to first educate the parents properly about what are they dealing with in terms of
right,
Prader-Willi syndrome.
right.
Second thing is we need an IQ assessment so that we know where to pitch our learning. And then the third thing is now usually the people I've come across with this syndrome, they appear to be normal, but their level of intelligence is generally at moderate retardation. So,
Oh,
people with the moderate intellectual disability, generally they have significant physical structural deficit as well. So, this child is a little bit of a mismatch, looking normal, but having a level of intelligence way below their actual age expectation. So, our job for this child would be not to make life more difficult for them, but how to make their life little easier, more enjoyable, so that they look forward to the learning sessions that we have.
right.
So reading and writing is likely to be quite tough for our child. So I would suggest we go for typing. So we teach them how to type on computer. We can use, if we can teach the child to read and the child already knows to read, then at least speech to text kind of apps will help them
Mhm.
to engage better with their learning material. So either audio work, audio stories, visual stories with videos, and using speech to text apps and typing, we can focus on small bits of learning and try to make that as uh, engaging for the child
Mm,
as possible.
mm.
And then later on, we can test if this is the worthy material for this child or not, and then take it forward from there. And the second focus for my child would be that we have to train them in the important life skills. So, life skill that the child should be having is one is the, how to manage money, even in
Mm.
small amounts. So, if we can start with that, how to look at time, then if they are to travel independently in the city, then sitting in an auto, sitting in a bus, these things I feel is very much important for the child to learn. And then some important skills in terms of cooking and managing their own work, at least that much should be there. So we start with those learnings, and if the child is given a lot of appreciation for achieving these things and being independent in them, I think reading, writing may be secondary in this child's life. So we can try focusing on these things.
These, yeah,
And
great.
you can give a feedback later on to Bala ma'am. She can maybe guide you further on that. Yeah.
All right. Thank you. Thank you, Dr. Sudipta, for that. And thank you, Sati. You're making an amazing effort with such a difficult child.
Really.
I really appreciate for that.
Yes, and the youth, all your youth will be required in
Yes.
working with this child. You will become young and energetic. Yes.
Absolutely. All right. Thank you. So the next question is by Sandeep Kaur. A 5-year-old girl whose speech language delay, poor in fine motor skills, poor spatial awareness, can write but not within lines, with big size letters, sitting, one sec. She sits with the task for 5 to 7 minutes, sitting tolerance 0, without task. Suddenly remember mother and starts crying bitterly. Suggestions, please suggest some strategies to improve her sitting tolerance without work.
Why do you want her to sit without work? If she has to work, then let her sit, I feel.
Exactly.
So the child seems to have a short attention span and visual motor difficulties. So our first goal would be that with a task, how can we enhance their attention span? So the sitting tolerance on a task should now be increased gradually to 10 minutes and then go up to 20 minutes, which can be done with using prompts, instructions, repeated reminders that you have to sit till the clock goes here to there and complete the task. So first task is to sit. The second goal is to engage yourself in what you're doing while you're sitting. So that is your second achievement. Once you get the child to focus on the task, be engrossed in the task for 10 to 20 minutes, then you will find that there is a change in their entire cognitive capacity. So then if you want them to sit without a task, then I think that is extremely
High expectation, actually.
yeah, high expectation. Because even if you tell me also to sit around doing nothing,
Not-
I'll be happy sitting. I'm one of those people who love sitting. But even then, if I'm not doing anything, the chances are I will get up and do,
Yeah.
I'll take some work. We have been schooled like that in our head. कि कुछ तो काम होना चाहिए हाथ में.
At least our mind will not be sitting.
Yeah.
Our mind will be occupied and planning for our next actions.
Yes. So you have to observe the child, across academic tasks, across tabletop tasks, across playground tasks, and across recreational tasks inside the house. So in all of these, you have to have a baseline for their attention span and gradually increase it by introducing rewards for an increment of about 5 minutes in each of these tasks. So once you have achieved that goal, then you might shift to better involvement in the task. So I make them do, if the child is old enough, we make them give themselves effort grades and interest grades. So on a scale of 1 to 5, where would you place yourself in the amount of effort you put in these first 10 minutes? So how would it be that in the next 10 minutes, you move up by 1 grade? So once you tell that to them, they may try to put a little more attention for the next 5 minutes maybe. So then the brain is learning to practice paying attention, and that is what is most needed for them. Yeah.
Great. Thank you for that answer, Dr. Sudipta. My next question is Sajita Praveen. This is my question. Some parents are not ready to accept their children has ADHD. Parents saying that child will change according to their growth. how can we convince such parents? And the other side, parents come and say our child has hyperactivity. Child keeps on doing anything, jumping around, uncontrolled actions, moving here and there. So how do we guide a parent and the child?
So, yeah, this is, of course, I think all of us have faced such tough situations with parents where you are trying to make them aware that the child has a certain issue, but they are not able to grasp it. So I think that's very important that we are sensitive to their issues. Like I would think that we have to understand that we're not up against the parents. It's not like I'm in one camp and the parent is in another. We are both thinking about the welfare about the child,
Child.
and we both are on one page. But the only thing is that that one page, in terms of effort to improve the child, can only come after the parent has understood what their child is facing. So it's up to us to make it as real as possible, that how is this attention span or the hyperactive level of the child different from the activity level of the other children. If you can help the parent to understand that, then you can also try and help them understand that how it is affecting their activities. Like, say, some parents are comfortable with their children being poor in academics, or some parents feel that okay, though they have an ADHD, वो सब काम, they're doing everything. So they have completed their schoolwork, they've completed their homework, and what more you want? But it's our job to make them understand that a long-standing inability to pay attention can have a lot of consequences on other tasks in their life. So it can affect their relationships, it can affect their employability, it can affect their career choices, and it might be that they're capable of a lot better academic performance, but they're performing poorly. So we need to make the parent understand all this very slowly across a few sessions. You can use any material that you like to make this a very real concept for them. So once they understand what you're trying to tell them through realistic examples that relate to their life, then they will understand how to that you mean well for the child. Until
Right.
then, you are just one of those who's being critical about their child.
Right.
Does that make sense to you?
Yeah, very much. I think because being a partner in the growth of the child is what is the first thing that a teacher and a parent together needs to start with. And I think that's where it makes a difference. Right.
Yes.
Thank you so much, ma'am. So next question is by Sri Vidya. What is the right age for an academic assessment for a child having learning differences?
An academic assessment for the child, yes?
Yeah, academic assessment for a child with learning differences. What is the right age for assessment?
So we can have assessments right from the age of 3. Okay. So you can have a set of assessments that can be done for 3 to 5-year-old. You can have assessments that can be done from 5 to 7-year-old, and then you can have assessments from 8 to 13 years. So most of the psychoeducational assessments and academic assessments are targeted from the age group of 8 to 13. And 8 years is considered a diagnostic years for learning disability. Before that, all the other tests will help you to identify learning difficulties so that you can judge whether the child is at risk for a diagnosis of learning disability at later stages. So the tests that you will perform from 3 to 7 years will help you to target your preventive actions. And at 8 years, you will be able to do a test which is diagnostic.
Great. Thank you. Thank you for that answer, ma'am. The next question is by Sangeeta. What is the difference between clinical psychologist and a psychologist? Actually, it's a very simple. Okay.
Yeah.
How can both effectively treat children with special needs? At what point of time does a parent intervene and take their child to you? There are three questions. First is difference between psychologist and clinical psychologist. How can both of them help a child? And at what age can a parent reach a psychologist, or you specifically?
So to differentiate between a psychologist and clinical psychologist, the clinical psychologist will have a master's and an MPhil in clinical psychology. They'll be trained in a clinical setting, hospital setting, and they will be able to deal with uh, serious clinical disorders and mental health problems. So they will work at a deeper level of pathology. Whereas a psychologist can be a master's in psychology and they may not necessarily have had any training in the clinical setup. They may have had a few internship opportunities to observe people working in different settings, and they will be able to do either developmental work, or maybe they will be able to work in organizations, they will be able to work in NGOs, they may work in small counseling centers, and they will be able to um, both of see as far as our special needs child goes, the psychologists themselves can work at a minor behavioral level to
Right.
counsel the child and to work with the parents. But the clinical psychologist will be able to do the testing, they'll be able to do any diagnosis, they'll be able to do any certification that is required, and they will be able to work at a deeper level to bring about long-term transformation in the pathological issues in the child and the parents. Like that. And they would work in a clinical setup. So
Basically, the
depends on-
assessment, right?
Yeah.
The major difference is the assessment is only supposed to be done by a clinical psychologist.
clinical psychology, yeah. So intervention, the level of intervention will vary, and the depth of intervention also will be different. So, like say, psychotherapy can be very in depth, and so the clinical psychologist would know a number of types of psychotherapy that can work at an in-depth level. Whereas an MA in psychology may know one or two such therapies to a superficial level, not in complete depth. That
Great, great. Thank you, thank you. And what age? The last question was at what age?
yeah. So the children come to us as small as 1.5 years or so.
Oh,
Yeah, and they people up to 90 years also come to us. So it's an entire lifespan.
so there is a test for a child with 1.5 years, or is it as
Yes,
per the
yes.
response of the
Yeah.
parents' observation?
Yeah, it will be responded by the parents.
Okay.
But we have the PDST, which is the pediatric developmental screening test. You have the Vineland social maturity scale. These can be done with very young children.
Young children.
So the
All right.
youngest kid I've had is 6 months old.
Oh, oh my God, that's great. Okay, the next question is by Dr. Shweta Kamath. How do we convince parents to do a psychological test in case of LD? Most of the time they have reluctant to take the first step. How do we simplify the whole thing for them so that they can go ahead with the tests willingly?
Yeah,
It's a
yeah,
vague
very
problem.
important. Yeah,
This
very
problem's
important.
been there for years and years now.
So I can tell you the steps, but that doesn't necessarily mean that your parents will get convinced. So that is another ball game altogether. But our job is to try and convince
Yeah.
them. So what I would say is that we first show them what are the learning difficulties you've noticed and over how much of a time. And there is something called RTI. I'm sure you are aware in the context of remedial interventions for learning disability, which is response to intervention. So
Right.
that approach says that until so you can diagnose a learning disability by that approach only after having implemented strategies to remedy their learning difficulties for 6 months. So first, when you've observed that the child has a learning difficulty, you take your time for a month or two to observe them, define the difficulties that you've noticed properly, and then try to intervene. So if the child doesn't have an LD, they will respond to whatever interventions you are taking. If the child has an LD, despite your working with them in creative ways, it hasn't made a difference.
True.
So that's when you will definitely refer them for remedial intervention. So you will then what I would do is like I would take the books of children, maybe one child who is at the academic in top 5 or top 10, and our child who's having a difficulty. I'll also take the book of a child who is in the bottom ladder but may not have I have a learning disability, and I'll show them the difference. That here is a child whose concepts are clear; they are able
Yeah.
to do what they have to, and here is a child who's not doing well but doesn't have any such learning difficulty. But here is your child who has a difficulty. And
Right.
the only way to deal with this difficulty is by seeking the right help. So you have to explain them that how LD is a neurodevelopmental condition where the brain wiring is slightly different.
Right.
And so the subtle differences that you see in their learning doesn't happen. I mean, it can't be judged without a proper assessment.
Right.
So if you go to a clinical psychologist or a psychoeducational, go through a psychoeducational assessment, then you will get a complete profile of your child's learning abilities, strengths, as well as weakness and deficits. And you'll come to know if the child fits a diagnosis. And then the need to know the diagnosis is such because that there are school accommodations
Right.
which are available to children who actually qualify for this diagnosis. And there are steps to be taken. And the earlier you take those steps, the better chance the child has of an academic success. So it's up to you to take the actions quickly. You can leave it at that. Tell them respectfully. Don't have to thrust it on them. Don't have to push them.
Yeah.
Show them that it's for the betterment of your child.
Yeah, this is exactly what I educate in my platform also, Dr. Sudipta, that first start working with the child. The minute you identify there is something not normal, is to take action and find, help the child with different strategies. If the child is able to respond well, fantastic. If not, change your strategies and try. And when you actually have a proper proof, written or oral proofs, that's where you can actually convince the parents saying that I have made my efforts of helping the child, but he will still need, he or she would need an intervention to diagnose the problem correctly so that the right solutions can be provided.
Yes, so important because otherwise, what the parents feel. This is I've seen this in Gujarat a lot. Like the parent feels, okay, I'm paying fees to the school. Now
Yes,
it's the
their problem.
teacher's headache. Why is my child not learning? It's something
Right.
the teacher hasn't done.
Yes.
So in a way, you as a teacher, you have to prove yourself to the parent that I'm
True.
genuine. I have your child's best interests at heart, and I have done my bit before I came to you.
Right.
So once they are convinced of that, it has to be a very dysfunctional parent who is not convinced that you are genuine in your words. So,
Absolutely.
yeah.
Thank you so much for that answer too, ma'am. The next question is by Bhageshri Rawale. Which medicine is effective on ADHD? Homeopathy medicine field, you mean? Okay. Homeopathy, allopathy, or any other with less side effects?
So I think I have gone across the entire scale, Ayurveda, homeopathy, and allopathy. So Ayurveda has been helpful in some cases, very few cases. Homeopathy has been successful in more cases, but to a small extent after long years of medicine.
It is slow.
So yeah, so maybe it's like in 1 year you would find like 10% difference in the activity level. Over 3 years of homeopathy medicines, you find 25% difference in their activity level or attention span. But in the allopathy medicines, in 10 days, you see the difference in their attention span. However, if the medicine is not well chosen, then you would see other side effects, like say grogginess, numbness.
Drowsy.
Yeah. So, and you find that the child is a changed person and has become some dumber creature who is not really the child you used to know. So, if that is happening, that's a signal that the medicine is not going in order, which could be because either it doesn't suit the child well, or else that we need to experiment with another drug of choice with the child. So we have to be vigilant for all of this. So if the child has a very severe level of ADHD and is having combined type of ADHD, and many areas of their functioning are disrupted, especially any two areas if they are completely disrupted because of the ADHD, better thing is to try out allopathy even for a short time. Sometimes especially if the learning years are being affected, like say if a child is from first to third standard, or maybe senior KG to third standard, it's the formative learning years. If the child doesn't pick up the basic concepts then a lot is lost, because then the later years of learning become much difficult. The child might get engaged in other things and look for more and more compensatory activities. Okay. So I feel the risk is huge. So in those learning years between 6 to 8, if the level of hyperactivity is too high, affecting at least two areas of functioning, then we would suggest allopathy. And then couple it with the homeopathy for at least 6 months. And then afterwards, you can taper the allopathic medicine and switch completely to hyperactive. To homeopathy, yeah. And during that time, behavioral intervention, cognitive interventions also have to go on, so that the brain is learning to live without ADHD also.
It's just not about medicine. It's about the whole environment that you need to create for the child.
So very concerted effort for 2 to 3 years between the ages of 6 to 8 generally brings about the best results in terms of ADHD.
Is it that we start a medicine and the child has to have it throughout their life, or can the dose be reduced or bring it down to 0? Does that happen?
Yes. So that is a misconception. It's a myth that once you start medicine, you have to take it all your life. No. It's if the ADHD is not solved and it's continuing to affect life even after stopping the medicine, then we might consider taking it on. So it's not that the medicine has to be continued because the person is dependent on them. Right. It's because the symptoms haven't abated and it is still affecting their life as much. Like it's, for example, if you are taking the medicine for diabetes, so many times you continue taking it all your life.
Right.
And why are you doing that? Because the sugar levels are not under control without the medicine.
Right.
The same thing about the ADHD. The brain activity is not under control without the medicine. Right. That's when you would continue the medicine. And but mostly developmentally, after the age of 10, there's a drop in the hyperactive impulsive symptoms. So it appears that the child is sitting better and is not so disruptive, but that doesn't mean that their attention span has now improved completely. So that will still persist. Yeah. In many cases, all their life.
Basically, the physical movement would reduce, but the mental movement is as high. In fact, more sometimes.
Yes. Yes.
And if we can divert their attention to productive activities, then they are less, less damaging to the environment. Great. We have lots of questions, ma'am, and I know it's already 4:18. Let me see how many we can address today. So the next is, this is by Sangeeta Arora, how is CBT helpful for dyslexics? How to remove fear of sleeping alone and also other fears regarding survival issues. This is, I think, for an adult child, maybe around 30 plus, sleeping alone at this age also. So does CBT help a child like this?
With sleeping alone issues, you have to use hierarchy of situations related to sleeping alone and then desensitize the person to that fear. So you will use those treatments which are used for phobias, nothing specific to dyslexia. Anything that works with a phobia will work for this person also. So we use a systematic desensitization procedure and gradually make them more comfortable about being able to sleep alone. And then it will go, it doesn't take too much time, would take about 3 weeks to 1 month max.
So do you give such kind of treatment or guidance to the parents?
Yes, we do that. Yeah.
So I think Sangeeta, you can, I'll share ma'am's number with the permission, and you can directly get in touch with her and take on counseling or whatever suggestions ma'am would give you. I think that will answer your query. Thank you so much. Next we have Roopa. Her question is, children playful destruct things. So how early can we recognize behavioral issues in a child? At what age? Children playfully destruct things. Okay.
So what's the question? If they're
So
children?
her statement is, children playfully destruct things. So how early can we recognize behavioral issues in a child? This may not be a behavioral issue. I mean, playfully destruct things. And then another question by her is, how to guide a child who's aggressive and comes up with a valid reason for the same every time?
Oh, yes, and that's a smart boy or smart girl. So basically, the thing is that this child has learned to cover up for their misbehaviors, and that is a warning sign that we need to help them understand their aggressive behavior in a different way. So that is like we need to educate them about how their aggression is, affecting people around them, how it's causing a dysfunction in the routine, and how it makes their brain shut down and think about only few things at a time. So then they will understand that the aggression is harmful to me. Then the next step would be to help them gain some strategies during the episodes of aggression by which they can gain control over it. So they might start being aggressive impulsively, and then you have some signals which you can use between them, like which you fixed up earlier, that this is what they have to do when they see you doing this sign. So then when you do the sign, the child has to learn to take deep breaths, calm down, move to another place, and then come back only when they are ready to talk in a non-aggressive manner. And then the next step would be that we prepare them to control their aggression before it bursts out. So during that we finished getting them in control, then the child becomes more amenable to stop the aggressive episodes before they come out. And then we'll also teach them some healthy outlets of aggression, so that they don't really suppress their aggression completely, but they learn to use it well to their advantage.
So they use this ABC concept, right?
Yes.
Antecedent, behavior, and
consequences. Yeah.
Great. Thank you for that answer, ma'am. The next question is by Kavita. Closes his ears very often, even during sleep. You mean your child closes his ears very often and even during sleep? Does it mean due to some noise or just as action? Okay, Kavita, can you please elaborate your question?
Yeah, ma'am. He always closes his ears, like this, or he hides it this way. Even in deep sleep also he does it, especially 3 to 5 a.m. Even the softest of noise, he's feeling very sensitive.
Can you describe your child to ma'am, because she may not know age and what condition he's going through?
He's 5 years, 6 months now, and he's been mildly autistic. He had learning difficulty, which I came to you, and now he's able to do everything. But this sensory issue, we don't know how to resolve or whom to reach out for this.
So this is this is a difficult problem. It means that the child is hypersensitive to sound, and so how can you make their ears quieten down? So that it would require a long-term intervention. Part of it would be the sensory integration that is done in an SI room that can help them, like where they introduce you to small sounds and help them become comfortable with those small sounds in that room, and then you increase the intensity and the pitch of those sounds and then make the child comfortable with those sounds. So that could be one thing. Or the second thing is that we might have to use certain types of what do you say, AI devices, or you know, yeah, well, like there are these devices which you put as a headband, and it has a connection to the ear as well, something like a headphone, and they will make a small soft rhythm, like just like a very small heartbeat. So listening to that sound in their sleep will then help them to calm down and not overreact to sounds. So we will have to use, that means we are using another distracting sound so that they are not focusing on the sounds in the environment. So over a period of time, their brain has to learn to ignore certain sounds and focus on those which are important. So it's a very long-term brain training activity. It's not something that will happen one-off with your child.
So do they have to go to some physical center where they do this kind of therapy or something for
So
the
the
child?
occupational therapists who are dealing with autism on a day-to-day basis, they should have an SI room, and in that SI room they would have this these different lights and sounds which can be used, and that would be very useful for them. But not every place has it. So that is the thing. Like many centers which are actually CGCs, they may not have an SI room. And if they have an SI room, they mainly have the what do you say, the other physical, the motor activities, but not the sensory activities which have to be done with the child.
So Dr.
So,
Sudipta,
yeah.
sorry, she lives in Bangalore. And do you have anybody, or can you suggest somebody to help her to reach out to the right place?
So which area in Bangalore do you stay?
I live near Kanakpura Road, ma'am.
So I will just check out and let you know, because I think there is one Dr. Akila. She's running a center called Some With, and that is in Kanakapura. But she's working with children with learning disabilities. So, but she is
Samved.
in Samved. She's working in the area of neuropsychology. So she might be able to help you with the child or guide you to where you need to go.
Great. That will be so much help, Kavita. If you can locate her, I think Google out, you will find the details about her very easily.
Yeah. Okay,
And I
ma'am.
think she's my LinkedIn friend. We keep exchanging great things online. So I think I've heard about her.
Okay.
Great.
I think
Thank
somebody
you.
messaged also in the group now. Yeah. Thank you so much, ma'am, for this.
Thank you. The next question is from Mr. C.K. M. Kumar. My daughter is 10-year-old. Teachers complain that she never listens and keep on talking. But when threatened to inform parents, she cries and says sorry. Again, she does the same thing. She's argumentative and quarrel with friends. Hence, had no friends. Please advise.
Very typical ADHD behavior. So this child is having problem with her impulsivity. So you will have to work on the impulsivity. And how can one do that? You need to look up in neuropsychological websites on activities that you can do to train impulsivity. I'll give you a small example of something that we used to do long back. Like say, I take the favorite chocolate of the child, I keep it on the table and I tell them that you cannot eat it before 10 minutes have passed. So, help them to delay their impulses in any activity form that you can. So, and then you tell them about, when we generally train them on appropriate classroom behaviors and inappropriate ones, and then reinforce them for the appropriate ones. So, say for example, if she is spending about 15 minutes not talking in the class, so that's the time that the teacher should definitely pay attention to her and compliment her on being so quiet, and that you'd like her to continue. And then maybe if you know that this is the end of her yeah, like her capacity to not talk is now ending, so you can actually give a talk break for 2 minutes or 5 minutes to the class, and then get back to your work. I feel that sometimes teachers get annoyed because it disrupts the flow of the class when the
Class.
child is continuously talking.
Hmm.
And second thing, I've seen a lot of sensitive teachers who feel that their authority is being undermined in some way when the child violates the rule that they set up. So in that case, we just want to make sure that uh, don't take it personally. All we need to know is that this child has to learn the rules of proper classroom behavior in any which way we can make sense to her for that. So you can talk to her alone in her break time, get a kind of relation or a rapport with her, then tell her about how you notice that she's talking in class, it might be disturbing others, and ask her, what can I do to help you remember to keep quiet in the class? So then she will be more open to listening to you, basically.
Yeah, this question is actually from the parent, ma'am. And I know the parents, both of them are working. The child has nobody to talk to the whole day. So she vents out everything in the school, and the school, a typical school, doesn't understand the child's emotions and lack of ability to communicate at home, and leads her to do this. So parent is helpless because they are working, but I would say that more effort from the parents to communicate with the child and mostly listen to her. What we do is a lot of advice, suggestions and advice when we come back. I've done this mistake a lot. So I keep telling them it's more important to keep our ears on and not our mouth on all the time. That helps children to share.
Yeah. Yes, very true. So you can actually encourage the child, like, encourage the mom to have a time of 1 hour when she meets the child after coming back from work.
Work.
That 1 hour can be devoted exclusively to listening to the child. So the
Right.
mother may have to rest or take her break only after that.
Yes.
पहले
Yes.
उसको सुन लो.
Sundar.
Not
Right.
necessary that the talking behavior would stop with that, but at
Yeah.
least see if the child is having some better release. Because
Yeah.
if it's a hyperactive child, the tendency would be talking all the time like that, whether at
Yeah.
home or at school. So
I
it wouldn't be a very focused
Yeah.
talk, just anything.
I experienced this till today as a parent. I would like to say this. My daughter, you know her, ma'am, she loves to talk. And every day, today she's a clinical psychologist herself, but she has to come back home and tell me her experience. She'll never share anything about her clients, but she'll talk so many things other than that. She'll never ever tell what her clients happened, what is the case, because that's your ethics. But till she doesn't do that, she's not normal, I would say. So I have to give her that time wherever, any time of the day, and just listen to her. And she's like, now I'm okay. She's not a small kid, she's 25, but she still needs it. So I'm also looking out for a groom who's a listener, because that will be her next need soon. The lighter side, we can't help it. We need to help our kids this way. All right.
But it's very endearing, I love it. The prattle of ADHD children is very endearing for me.
All right. Ma'am, how much time can you spare? Because it's more than an hour already. So I have many more questions coming.
We just take one last question.
Last question.
Yeah.
All right. Great. So the last question is, this has already been addressed actually. How can we deal with a hyperactive child? It's a very broad question. There's so much that can be told. So I'll take the next question. Should a child with mild symptoms like reading reverse letters, reading D, B, etc. be suggested to get the assessment done? And we are a remedial educator should work on it for a few months and see if the child is improving. I think this has been answered. And yes, as you said, first you work on the child and then see if the improvement is there. It's post that we take them for assessment. Okay. Any other specific? Let me just see how to make it. What is the earliest?
Just
Sorry,
a
ma'am.
question, Bala ma'am. What's the
Yeah.
age of the child who might be reversing the letters and all? And reading?
The age of the child is not mentioned here. Unnati, if you're there, can you please mention the age of the child in the chat box or in the mic? 9 years. 9 years, ma'am.
Oh, definitely needs assessment. Definitely.
Okay.
So usually there are reversals. They should have resolved spontaneously by the age of 5. If you are beginning some creative interventions, you may try it after the age of 5 for about 2 to 3 months. And if you feel that it's still not resolving, then definitely go in for assessment.
Great. Thank you, ma'am. I think we'll close today's session with this. Thank you for that wonderfully explained answer. Very to the point. I am sure all of you, all of us have learned a lot from today's session. Any last few words from your end, Dr. Sudipta, for us as remedial educators or remedial parents?
Yeah. No, it's been very enjoyable hearing out the questions and trying to answer them. And I hope I've been able to do justice to all of you. And it's been a pleasure. I loved it completely. Keep up the good work you're doing. Keep up your intentions of working with special needs kids in the right place. And learn and equip yourself with as many techniques and diverse ways of looking at these children that you can, so that you can meet their needs best. Because each child will come up with a new set of things. So once again, you have to rally yourself and again meet their demands in the best way possible. So it will keep you on your toes, this field.
Absolutely. I would want any one participant to share your experience or learning or something. Anybody, just one of you can come on the mic and camera and do it. Any volunteer. Okay, Mubashira, she rose her hand first. Yeah, Mubashira, just introduce yourself in a line and share.
Ma'am, myself Mubashira, Remedial Educator. I am in this field from more than 12 years. So I thought I am not able to join today because I'm very tired from morning. But luckily I am able to join and I learn so many things without asking any questions. I learned so many.
Great, great. Thank you so much. This is the first, Sudipta ma'am, this is my first attempt like this for my community, bringing an expert, and thank you so much for accepting. I am doing this with many experts like you so that I can add value to the people who are joining my system and learning from that throughout the life, because you know, special needs, every minute you have learned something new, learn a new strategy, learn a new technique and accept it. Thank you. Thank you so much and wish you all the best. Great health to you.
All too. Thank you all too. It's been very nice meeting you all. I am very happy to spearhead and kick off your series of expert talks.
Thank you.
Okay.
Thank you so much. Take care, ma'am. Bye-bye.
Thank you. Bye. Bye.
Bye-bye.